Hello, and thank you for joining me today. This presentation will focus on improving promotions for transitional care management, or TCM, services offered through the swing bed and inpatient programs at Snoqualmie Valley Hospital. Here's a quick look at what we'll be covering today. First, I'll give a brief overview of the product and service, specifically transitional care management and how it supports post-discharge. Then I'll walk through our current promotional practices in place, followed by an evaluation of what's working and where the gaps are. From there, I'll introduce targeted improvements designed to increase awareness and utilization. And then finally, I'll wrap up with a cost-benefit analysis to show how these changes can deliver both clinical and financial value. Snoqualmie Valley Hospital currently provides inpatient care, swing bed services, outpatient rehabilitation, and other clinical services for rural King County residents. However, it lacks a formal transitional care management program promotion, despite offering follow-up care for patients that are recently discharged from the hospital. So their TCM program integrates telehealth and in-office visits to support patients within the 7 to 14 days post-discharge. And this is designed to complement the hospital's swing bed and inpatient programs and reduce that 30-day readmission to improve health outcomes for older adults with complex chronic conditions. So the primary customer here is Medicare and Medicaid beneficiaries, especially those that are age 65 and older with chronic conditions such as congestive heart failure, COPD, and diabetes. The dominant marketplace is rural communities in the King County and surrounding service areas covered by Snoqualmie Valley Hospital. So moving on to the differential advantage for a transitional care management program, we're going to start with the importance. Transitional care management is critical in improving outcomes and maintaining strong financial performance in today's healthcare environment. For rural facilities like Snoqualmie Valley Hospital, TCM helps prevent that and avoid that 30-day readmission, which is a key metric in value-based healthcare today. According to CMS, patients that receive TCM services experience lower Medicare spending and better post-discharge outcomes. So according to the 2025 physician fee schedule, TCM actually has increased reimbursement rates and has strong evidence of its effectiveness in reducing Medicare cost, which points to this positive long-term outlook to these types of services. By capturing TCM billing opportunities, the hospital not only improves reimbursement rates, but it also avoids penalties under the readmission reduction programs. Moving on to perception. The integration of TCM services enhances community trust and strengthens provider partnerships. By demonstrating a commitment to coordinated patient-centered care beyond discharge, Snoqualmie Valley Hospital improves its reputation as a rural healthcare leader. The program signals to patients, families, and referring providers that the hospital is proactive in ensuring safe recovery, not just in hospitalization, and positively shows how the hospital is perceived in healthcare market. Its uniqueness, Snoqualmie Valley Hospital distinguishes itself through a flexible model of TCM, offering a blend of telehealth and in-clinic follow-up care. And this is especially important in rural hospitals where limited staffing and geographic barriers often prevent comprehensive transitional care. There is an opportunity to include mobile health visits to meet the patients where they are at when transportation access is an issue. So this flexible delivery method meets patients where they are and overcoming transportation challenges and care delays, offering a level of accessibility and responsiveness not commonly found in rural settings. And then sustainability, as I mentioned, CMS and other payers are increasingly shifting toward this value-based payment model. So TCM supports long-term sustainability. It aligns with clinical care and financial incentives by reducing the hospital utilization while maintaining compliance with post-acute care standards. So with ongoing reimbursement, supports and proven Medicare savings, TCM positions Snoqualmie Valley Hospital for a financial resilience and continued growth and a greater impact on the rural communities it serves. Snoqualmie Valley Hospital's current marketing strategy and promotion practices currently employs a basic marketing strategy which focuses on community engagement and digital visibility. Its target market includes rural and suburban residents of the Snoqualmie Valley area, particularly Medicare and Medicaid patients, aging adults seeking accessible healthcare services. The hospital's marketing segmentation is largely geographic and demographic, focusing on local residents who are more likely to utilize nearby facilities for primary care, emergency services, and rehabilitation. So the hospital's promotion mix currently includes digital marketing, which is the informative websites and periodic social media posts, which include Facebook and LinkedIn, that share general health tips, service updates, and event announcements. And then they also employ event marketing, which is participation in local health fairs and community events to engage directly with residents and distribute informational materials. And then also public relations. There's an occasional press releases and community newsletters that share achievements of new services, including recent expansion plans, which have been just announced. However, these efforts do not include targeted promotion for transitional care management services. TCM is typically introduced through a verbal conversation between the providers and the patients at discharge, rather than through a formal advertising or patient education materials. This informal approach limits the hospital's ability to raise awareness of TCM's value, such as preventing readmissions, offering at-home or telehealth follow-ups, and providing medication reconciliation and care coordination. So there is also an opportunity to incorporate concurrent billing for chronic care management, remote patient monitoring, end-stage renal disease services, and then INR monitoring. So moving on to the evaluation of current promotional practices. To evaluate the current promotional efforts, it's important to understand Snoqualmie Valley Hospital's strategic position. The hospital serves a rural, Medicare, Medicaid heavy population and provides a mix of acute care services and post-acute services, including the swing bed care. So while it operates within this value-based care framework, the hospital does not actively promote transitional care management, which is a reimbursable, outcome-driven service that aligns with clinical and financial goals. So the following criteria is used to assess the hospital's current promotions on TCM services. So number one, the strategic alignment. So does the promotion of service reflect the hospital's mission to reduce readmissions and advance value-based care? Number two, visibility and clarity. Are TCM services clearly presented across patient-facing and provider-facing platforms, including digital and print media? And number three, engagement with patients and referring providers. So are there structured materials and communication strategies to educate patients at discharge to support provider referrals? And so my assessment by the criterion that was created, starting with number one, the strategic alignment. So the weaknesses for strategic alignment of current promotional practices includes that TCM directly supports hospital goals like reducing readmissions and optimizing swing bed transitions, yet there is no actively promoted or integrated into the marketing strategy. Some of the strengths is that the hospital's existing swing bed program creates a built-in patient base for TCM, aligning with CMS quality measures and reimbursement models. Criteria 2, visibility and clarity. So the weaknesses include that TCM services are not mentioned on the website, social media, or patient-facing brochures. And it was also not present on the swing bed welcome packet. There was no mention of TCM on post-discharge services. So this lack of visibility likely contributes to the low awareness and underutilization. Some of the strengths are that the hospital participates in health fairs and maintains digital platforms offering a ready foundation for incorporating TCM content. Criterion 3 is the engagement with patient and providers. So the weaknesses are that there's no standardized discharge materials, referral prompts, or digital calls to action related to the TCM services. So current promotion is inconsistent and mostly verbal. Some of the strengths are that there's strong relationships with discharge planners and referring hospitals could be leveraged for provider education and increased referrals. So Snoqualmie Valley Hospital has the infrastructure, patient base, and clinical alignment needed to support a high-performing TCM program. However, the lack of strategic promotion limits patient awareness, provider referrals, and reimbursement potential. So by improving the visibility, clarity of the TCM offerings and formalizing engagement strategies, the hospital can better align marketing efforts with its mission and of value-based goals. So ultimately improving outcomes and financial sustainability. So moving on to the recommended improvements for the TCM promotion. So to close the current gaps in awareness and engagement around transitional care management at Snoqualmie Valley Hospital, we recommend an integrated promotion strategy built around the pillars of patient education, digital visibility, and provider engagement. So starting with patient education materials, so improving patient understanding begins at discharge. So a clear, accessible materials would be distributed consistently to explain TCM benefits and the next steps. So this would include customized discharge packets for swing bed and inpatient patients that explain what TCM is and why it matters and what to expect in the follow-up care. And then also this would include trifold brochures to be placed in waiting areas, clinics, and handed out at community health events to educate both patients and caregivers. And then next with digital promotion, and this would be our owned and paid media. Digital channels are essential for reaching caregivers and adult children who often make the care decisions. So launching a dedicated TCM webpage with FAQs and eligibility information and a call to action to schedule follow-up care. And this can be done on the existing Snoqualmie Valley website with just a TCM link in addition to what is already there for a swing bed and inpatient. And then also running targeted Facebook ads for rural seniors and caregivers using simple, relatable messaging. And then also posting short YouTube testimonials with staff explaining how TCM works and how it prevents ER visits and complications. So this approach increases visibility across the platforms and supports CMS's emphasis on digital health outreach. And then provider outreach using the needs satisfaction method. So to improve patient or provider education and referrals, Snoqualmie Valley Hospital can apply the needs satisfaction method, which is a structured sales approach built around understanding and addressing the provider's specific challenges. So step one would be the needs development. So a designated liaison, such as a care coordinator or RN, who engages with providers and discharge planners by asking direct and thoughtful questions like, what barriers are your patients facing after discharge? Or what would make referring to TCM more efficient for your team? Step two would be the needs awareness. So through conversation, providers often recognize issues of lack of follow-ups, unclear eligibility, or missed opportunities for coordinated care. So the liaison or care coordinator can help connect these gaps to the benefits of TCM, including improved outcomes and CMS reimbursement. And then step three would be the needs fulfillment. So once the needs are identified, the TCM team offers a tailored solution. So this can include referral cards or workflow guides, which are quick and easy to use, email updates featuring patient success stories and documentation tips, and then handouts for providers at meetings and care coordination teams. So this method strengthens relationships, builds trust, and positions TCM as a solution that both benefits patients and providers. So to ensure a consistent messaging, and maximizing the impact of our outreach efforts, Snoqualmie Valley Hospital will implement an integrated marketing communication strategy. This approach aligns with all promotion efforts, whether digital, print, or in person, around a unified brand message that reinforces the value of transitional care management. So by coordinating messaging across these multiple platforms and touchpoints, the hospital can ensure that patients, caregivers, and providers all receive clear, consistent, and actionable information about TCM services. So the IMC strategy includes owned media, which is the hospital's website, discharge packets, clinical signage, and printed brochures distributed to key patients and caregiver locations. Paid media, which would be our sponsored Facebook and LinkedIn ads targeting rural caregivers and potential patients. And then our earned media, which would be local newsletters, press releases, and then also word of mouth, driven by patient success stories and positive provider experiences. So all promotional material will reinforce a single trusted message, which is recover with confidence. We stay connected after discharge. This slide here shows an example of what an improved brochure could look like for promoting transitional care. So it clearly outlines the mission of the program to support patients after discharge through a flexible patient-centered care. And it also includes simple explanation for services provided, such as medication reconciliation, follow-up visits, and then coordination with primary care providers. So moving on to cost-benefit analysis for implementing the proposed changes, including distributing customized patient education materials, attending local health fairs, and enhancing its digital outreach for swing bed and transitional care management services. This only requires a modest investment thanks to the existing infrastructure that Snoqualmie Valley Hospital already has in their marketing. So the core marketing infrastructure is already in place, including a marketing specialist, functioning clinic website, and active social media accounts. So this significantly reduces upfront cost, which allows us to promote these TCM services without building from scratch. So the estimated cost, starting with the health fair markets, I grabbed some of this data off of a local health fair in Issaquah, which is the neighboring city, and I estimated that the cost would be about $1,000 per event. The booth fee, there's initial and reoccurring costs for businesses, staffing for 2 employees for say 8 hours a day, and then printing of educational materials. The printed brochures, I said about $500 per quarter. And then Facebook, for Facebook and digital promotions, we're estimating around 25 target conversions per month, so such as appointment request or care form submissions. So based on the average cost per action of $18.68, the projected monthly cost would be about $467 for this. And then provider education, we would say about $1,000 a year for our liaison or care coordinator for scripting, briefing, and training the providers to enhance outreach to and engagement with patients on the TCM services. And then marketing support. So since we already have a marketing specialist that is already staffed at Snoqualmie Valley Hospital, we estimate about $5,000 a year from the current staffing structure. So moving on to the potential reimbursement methods. So this would be the benefit from our cost. So by promoting these services earlier and more consistently, particularly in swing bed and inpatient high-risk discharge patients, this TCM can increase utilization of the billable care coordination services. So here we have the TCM CPT codes and their current reimbursement for in our area. And so if we were going to be using that 25 patients per month point that we used earlier, that's about $4,950 to $6,950 a month of reimbursement. And then I also included chronic care management and RPM, which are services that can actually be billed concurrently and often are very important in these post-discharge appointments. And so I calculated the reimbursements, the current reimbursement in our area, as well as using that 25 patients point to calculate how much a month. And so overall, we have over 7,900 benefit per month versus our cost, which was minimal. So to summarize what we've gone over today, Snoqualmie Valley Hospital has this valuable opportunity to enhance both clinical outcomes and financial performance by improving the way it promotes these TCM services. So while the hospital has a strong inpatient and swing bed programs, the lack of structured TCM promotion limits patient engagement and leaves revenue on the table. So by implementing these targeted improvements like discharge education, packets, community outreach on local health fairs, and a stronger digital presence, we can increase awareness and utilization as well as patient follow-through. So these changes require minimal investment thanks to the existing market infrastructure, and which is easily offset by the potential monthly reimbursement, which is exceeding $7,900 per month through the TCM and then concurrent billing opportunities for chronic care management and remote patient monitoring. So ultimately, this strategy not only closes the promotional gap, but it also strengthens our position as a rural healthcare leader committed to continuity of care, reduced readmissions, and long-term sustainability under this value-based care model. So I wanted to thank you for taking the time out to listen today. I hope this presentation has shown you how a small targeted changes in our promotional strategy can make a meaningful impact for both the patients that we serve and then the long-term success of our TCM programs. Thank you.